Hi everyone, just wanted to go over some of our info from last week and this week to come, as well as a couple of quiz questions. So last week we were talking about market information systems, market research, mass marketing versus segmentation or targeting, etc. And we had our discussion, which was about online market research. And then our written assignment about Mayo. Hopefully you found that helpful. Mayo Clinic is phenomenal at social media marketing. They've just, kind of set the standard, and there are some others out there that are quite good as well. But they've really set the standard to not only provide um, detailed information about their items and services that they can provide if you happen to be in the area where there is a Mayo Clinic location, but also just to provide general health information. I actually haven't been out there since this COVID-19 stuff has been going around, but I'd be willing to bet that they are just every day putting up new podcasts, new information about not just what Mayo can do for you, but also just general health info. And I think that that's really a neat way to really portray yourself as an expert in the marketplace. So then we also had our quiz for last week and our Ed puzzle. So let's flip over to week 5 quick here. Actually, let's go over the quiz questions first, and then we'll go to week 5. So, our quiz for last week, first question: to be successful, marketing strategy must be built primarily on segmentation. And the answer was false. In the textbook, I think it's in chapter 8, it talks a bit about segmentation and targeting, and they refer that as micro marketing. So, that is marketing based solely on a specific segment or something very detailed to target the marketing. However, general mass marketing is also very successful. Good example being what I was just talking about with Mayo. It's not that they are targeting specific people. It's just a general mass marketing campaign, and that can be really successful. So our answer there is false. Segmentation can be helpful, but it doesn't need to be primarily built on that. Marketing manager's role is to ensure the organization has a strong marketing presence in the community, and actually that is false. I'm just trying to find the page here. The In our text on page 181, it talks about the role of the marketing manager, and their role is really as a conduit between those decision makers in the organization and that environment. So the marketing managers have a hand in that marketing presence, but it's really more about serving as that conduit between what the organization does and decision makers, and then that external environment, and actually the internal environment as well, because you can use marketing tactics with your own staff. So that role is not just to say, hey, community, we're really great at what we do. That is, can be part of what marketing managers do, but their role is to serve as that conduit between senior leadership and the decision makers in the organization and their environments, be it internal or external. Medical subspecialties would most likely demographically segment by, and our options: life stage, gender, disease category, and payer mix. So our answer is disease category, and think about what it is that medical subspecialties do. So, for example, if you, let's say you are a medical oncology practice, you could segment the population by life stage or gender or payer mix, but that's not going to get you to the people that necessarily need your services. By segmenting your population demographically by disease category, you'll be sure that you'll be reaching those people that need medical oncology services, as opposed to just all people over 50 or all people that have Medicare or all people that are women. You want to make sure that you are really segmenting by disease category to make sure that you are getting to those that require your subspecialty, and it's not a wasted effort or wasted money in those instances. Last question here. Most healthcare systems are market driven, and if if you've taken economics, the healthcare economics class already, you likely know that in fact they're not market driven. Healthcare organizations are very much not market driven. When you think about the market and the notion of supply and demand, generally the healthcare industry does not respond to supply and demand like other industries. Good example right now. You go out to put gas in your car, and it's 50 cents, 60 cents cheaper than it was, 2 months ago. And there's lots of reasons for that, but one of the reasons is that the demand has decreased exponentially. So demand goes down, costs go down, or costs don't go down, prices go down, cost to us. Whereas if you look at healthcare right now, the demand in healthcare has risen again exponentially. People need those coronavirus tests. People need to get into hospitals if they're sick. They need to see physicians, etc. Um, the prices in the healthcare system have not gone up, though, like they would if they were, toilet paper or milk or bread or those types of things right now. Where when you walk into your grocery store, you're probably paying a little bit more for some of those things than you were a couple months ago. The healthcare system is not market driven. It doesn't rise and fall in the same way that other market driven systems like retail do. So, if you haven't taken the economics class yet, you'll learn a lot more about the notion of market and how supply and demand impact the healthcare system overall when you get to that. So let's go over here to week 5. So this week we will be looking at managing product and service offerings, developing and branding new offerings. So this will be helpful information for you as we are moving into working on our final projects. We have a discussion about surgical patients in rooms with natural light. Again, I encourage you to think in depth about these things. I think perhaps I've mentioned this in other videos or other discussions, but try and dig into these topics a little bit so that the discussion is a bit more robust. And then we have our quiz and this ed puzzle, which will go there. But I also encourage you, I'm going to flip forward to the final project. And we've already, we've talked about it already. I reviewed your topic selections. Please go in and take a look at the feedback on those because in some instances I gave you some feedback on ways to tweak your final project. But your final project is going to go here in week 7, the overall strategic marketing plan, and you'll actually be submitting it down here to the Turnitin link. But if you have any questions, I would suggest beginning to work on that information. It would be helpful to have a few weeks to work on that. It is a sizable project. But you will be learning more in this week, in week 5, about how to shape and brand those product and service offerings. So hopefully that'll be helpful to you as well. So any questions, please let me know. Otherwise, I will talk to you all in the classroom. Thank you.